including diabetes and hypertension, should visit with their health center. Let us work together to protect others against dengue and other illnesses.
I was first diagnosed with cervical cancer at age 33. The treatment was not pretty. It was terrible. I couldn't go to work, and I spent the whole 5 years out of work. The pain, the struggle, I removed my womb. I thought, I'm finished with cancer. 2016, cancer come back. There's hope for your daughter. My experience don't have to be her experience. So mothers, give their children the vaccine. It will be good for your sake and for the children's sake.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
I want to see a Jamaica that is cervical cancer free. Cervical cancer is one of the leading causes of cancer in women in our nation, and I want this to stop. The HPV vaccine has been proven to be the most effective method to prevent cervical cancer. It is a safe vaccine, and it is best to give the vaccine to young girls before they've even been exposed to the HPV virus. So parents, I want to encourage you to let your daughters get the HPV vaccine. Let us protect our next generation against cervical cancer.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
I love my children, and I will do anything to protect them. So that's why, as a mom and as a doctor, I made sure that my daughter got the HPV vaccine to protect her from cervical cancer later in life when she becomes a woman. The HPV vaccine is very safe and effective.
I was afraid of the injection at first, but I got it and it really wasn't that bad after all.
If there was something you could do to protect your child, wouldn't you do it? Protect our next generation. Ensure that your daughter gets the HPV vaccine today.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
Your health is your wealth, so come we start the conversation. Make we rise and immunize all across the nation. The ministry is giving us the motivation to get your infants routine immunization. Protect the toddlers from all diseases. Tetanus, rubella, whooping cough and the measles. Polymyelitis, mumps and the flu, plus tuberculosis to name a few.
Rise to immunize. Eliminating diseases saves lives. Visit your nearest clinic or health center for more information or log on to www.moh.gov.jm. A message from the Ministry of Health and Wellness.
Do your part to prevent mosquito breeding. Mosquitoes will breed in any container that holds water.
Tightly cover water storage containers such as drums, barrels, buckets and tanks. If this cannot be done, pour cooking oil on the water surface. Punch holes in all tins, plastics and beverage boxes to prevent the collection of water before disposal. Cover all tires or fill with dirt to prevent water collection. Scrub all vases once per week to remove mosquito eggs. Use mosquito repellents to protect yourself from mosquito bites. Dispose of garbage properly by placing in plastic bags and securing properly to prevent water collection.
A message from the Ministry of Health and Wellness.
Come pre this you, don't pre that. Let me tell you about the body and some physical facts. Come pre this you, don't pre that. Let me tell you about the body and some physical facts. Physical activity defined as bodily movement. You know it beneficial to every student. Chin up, push up, jogging, sit up, feeling lazy. Better get up. Physical activity help your mood and memory, make you remember anything, cause it boosts dopamine and serotonin. Target attention, focus, regulate moods. Come learn something. Yeah man, listen young youth. Physical activity, healthier weight, go and exercise, students hold the faith. The more you do, the more calorie your body use. Calorie deficit, calorie get reduced. Exercise build your bone and make it more dense. A facts we attack, ladies and gents. Physical activity is of the essence, needed like full stop in any sentence. Come pre this you, don't pre that. Let me tell you about the body and some physical facts. Come pre this you, don't pre that. Let me tell you about the body and some physical facts. Physical activity.
During this time, with online schooling, we are sitting for too long. The problem with sitting for too long is that it leads to soreness, aches, and pains throughout our body.
3, 2 more, 1, 2. Adults to 30 minutes activity daily. Love your body, treat your body right. Vegetables, make sure you eat plenty. Children do 60 minutes activity daily. Drink some water when you feel thirsty. Cut down dessert and have a smoothie. Jamaicans, love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. One more time now. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. Listen up. Make sure you know your health status. Go a doctor and get a regular checkup. Chronic disease can slowly creep up. We can lower the risk and live up if we just eat right and get moving. Jumping, running, dancing or skipping. Change the children, them lazy habit. Make them play out the door and put down the tablet. Jamaicans, love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. Jamaica, get moving. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. After 2, make me hear you say I love me. 1, 2. I love me. 1, 2. I love me. 1, 2. I love me. After 2, make me hear you say I love me. 1, 2. I love me. 1, 2. I love me. 1, 2. I love me. Jamaicans, love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. One more time now. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. Jamaica, get moving. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. One more time now. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. Listen up. Love your body, treat your body right. Love your body, treat your body right.
Become the hero on the scene by taking the COVID vaccine. Get vaccinated as soon as you get all the facts. Don't listen to the rumors. This vaccine might just make it possible for teachers to sit face to face with schoolers. This vaccine make it safer for everybody, from the young to the elderly. Don't you want to go back to living normally when things were more orderly? And if you want to live a long good life, then we all have to do what's right. So let's get vaccinated along with the heroes on the front line.
A message from the Ministry of Health and Wellness.
Hospital visits are anticipated to increase up to the end of this year and into the first few months of next year as we see more cases of dengue, flu, and other illnesses. As a result, emergency departments may be overcrowded with longer waiting times. We have therefore extended opening hours at select health centers island-wide. Persons with mild illnesses and chronic diseases, including diabetes and hypertension, should visit with their health center. Let us work together to protect others against dengue and other illnesses.
I was first diagnosed with cervical cancer at age 33. The treatment was not pretty. It was terrible. I couldn't go to work, and I spent the whole 5 years out of work. The pain, the struggle, I removed my home. I thought, I'm finished with cancer. 2016, cancer come back. There's hope for your daughter. My experience don't have to be her experience. So mothers, give your children the vaccine. It will be good for your sake and for the children's sake.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
I want to see a Jamaica that is cervical cancer free. Cervical cancer is one of the leading causes of cancer in women in our nation, and I want this to stop. The HPV vaccine has been proven to be the most effective method to prevent cervical cancer. It is a safe vaccine, and it is best to give the vaccine to young girls before they've even been exposed to the HPV virus. So parents, I want to encourage you to let your daughters get the HPV vaccine. Let us protect our next generation against cervical cancer.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
I love my children, and I will do anything to protect them. So that's why, as a mom and as a doctor, I made sure that my daughter got the HPV vaccine to protect her from cervical cancer later in life when she becomes a woman. The HPV vaccine is very safe and effective.
I was afraid of the injection at first, but I got it and it really wasn't that bad after all.
If there was something you could do to protect your child, wouldn't you do it? Protect our next generation. Ensure that your daughter gets the HPV vaccine today.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
Your health is your wealth, so come we start the conversation. Make we rise and immunize all across the nation. The ministry is giving us the motivation to get your infants routine immunization. Protect the toddlers from all diseases. Tetanus, rubella, whooping cough and the measles. Polymyelitis, mumps and the flu, plus tuberculosis to name a few.
Rise to immunize. Eliminating diseases saves lives. Visit your nearest clinic or health center for more information or log on to www.moh.gov.jm. A message from the Ministry of Health and Wellness.
Do your part to prevent mosquito breeding. Mosquitoes will breed in any container that holds water.
Tightly cover water storage containers such as drums, barrels, buckets and tanks. If this cannot be done, pour cooking oil on the water surface. Punch holes in all tins, plastics and beverage boxes to prevent the collection of water before disposal. Cover all tires or fill with dirt to prevent water collection. Scrub all vases once per week to remove mosquito eggs. Use mosquito repellents to protect yourself from mosquito bites. Dispose of garbage properly by placing in plastic bags and securing properly to prevent water collection.
A message from the Ministry of Health and Wellness.
Come pre this you, don't pre that. Let me tell you about the body and some physical facts. Come pre this you, don't pre that. Let me
Welcome to the Ministry of Health and Wellness's press conference. Today is Thursday, July 18th, 2024. We apologize for the late start. So, of course, we want to provide you with some critical update regarding the health and wellness portfolio. And so this morning we have the Minister of Health and Wellness, Dr. the Honorable Christopher Tufton. He is joined by the Permanent Secretary, Dunstan Bryan, the Chief Medical Officer, Dr. Jacqueline Bisesa McKenzie, the National Epidemiologist, Dr. Karen Webster-Carr, Dr. Nadine Williams, Director of Health Services Planning and Integration, Dr. Simone Spence, Director of Health Promotion and Protection Branch, Mr. Michael Williams, the Director of Environmental Health, Dr. Nicole Dawkins-Wright, the Director of Emergency Disaster Management and Special Services, and Mrs. Shireen Huntley-Jones. And I always get in trouble when I start calling names, right? And the chief nurse, Mrs. Patricia Ingram Martin. So the full team is here to give all the information that is required. And we're going to begin with the update from the minister.
Sorry, you don't mind my sitting here? You want me to get the one go there?
Oh, the heads are blocking, so you have to see.
All right, so. Making it a little more challenging. For the flexibility that you have exercised to accommodate me. We all now have a renewed interest and empathy for the disabled community, right? All right, so thank you very much, Stephen, and thanks to the media and to my colleagues who are here at the head table, PSCMO, Ms. Huntley-Jones, others in the audience, and of course to you, the media. It's been a while since we have had a press brief of this kind, and we thought it was important to give an update to the country on the state of public health, in particular in the aftermath of Hurricane Beryl. I mean, we have been doing so through releases, but felt that it was necessary to have a sit down with you to allow you to ask any questions on Beryl and the recovery efforts, as well as on any other issue of interest in public health. And this would follow an update that we will give on at least two very important areas. One is the recovery efforts to our health facilities, and secondly, the challenge of mosquitoes, which I know is a topical issue now, as we would have expected in the aftermath of a flooding and the storm of this kind. All right, so let me begin by saying that speak to the challenges of our health facilities. Are you okay? You're fine? Okay. Let me begin by speaking to the challenges of our health facilities. So approximately 82 or 23% of all health facilities sustain major damage. That is a structural issue, major damage being defined as a structural issue that impacted the ordinary running of the facility. Now, this is following the last 2 weeks of assessment. You will recall that we had given a preliminary assessment earlier, but the team have been in the field in the regional health authorities doing structural examination of buildings, roof, and so on. And we believe that what we have now reflects a much more accurate depiction as to what has transpired post-burial. So 82 or 23% of the total major damage sustained, 41% is impact to roofs, so roofing damage. A number of our facilities have lost their roof, those that have been impacted, or at least have damaged roofing, which has led to water intrusion within the building and, of course, contributing to damages to a number of internals. Impacts to windows and doors as well as electrical supplies were also identified among the major damage to health facilities. It's to be noted that 76% of total costs for the rehabilitation of the health system are in the Southern Regional Health Authority, that is the parishes of Clarendon, Manchester, and St. Elizabeth, and the Western Regional Health Authority, which is Westmoreland, Hanover, St. James, and Trelawney. Thankfully, in terms of hospitals, some 23 of our 26 hospitals are now back to normal operation, so 23 of 26. The remaining 3, Black River, Noel Homes, and Falmouth General, are still operating in emergency mode, and we're taking all the necessary action to get those back up as quickly as possible. Up to last evening, I saw some footage, pictures and videos sent to me from Falmouth, where a lot of work is going on in terms of roof repairs and so on. In terms of the recovery plan, the ministry has developed a recovery plan that is to do the following. Firstly, to bring the operations in all health facilities back to normal capacity within the shortest possible time. Address all remediation that may affect service delivery, so bring service delivery back up to normal, and make more health facilities climate resilient, a medium to longer term strategy, by applying the WHO PAHO Smart Facilities Standards. You may recall that we have a program currently where, guided by the WHO PAHO, called Smart Facilities, that are facilities that would be resilient to climate-related extremes. And we have about 19 facilities now that have benefited from this smart facility designation. So things like solar panels, water storage, all the things that would, storm shutters, the things that would ensure that those facilities withstand the sort of extreme weather patterns. And so we have the standards. Those facilities held up. And what we want to do now is to, over the medium to long term, meaning over the next few years, and I'll get to that, begin to apply those smart facilities as we recover and rebuild the facilities that have been impacted. We're also moving with the Cabinet's approval, and these discussions have taken place at Cabinet, to implement the plan in 3 phases. The first phase involves activities that will bring the facilities back into full operation within 6 months. So those facilities that need the sufficient work or some work to get back into full operation within 6 months, we're going to be tackling that as a first phase in order to ensure that normality is restored, particularly in our health centers that have been most affected. The cost for that, based on all the estimates done, is approximately 1.7 billion Jamaican dollars. That's 1.729,970,441. So 1.7 billion approximately. The second phase, which we classify as restore. So the first phase is to restart. The second phase is to restore. And that will address repairs to parts of the buildings that have been damaged, but which do not affect operations, and is to be implemented within 6 to 12 months. And the cost for this is approximately 2.1 billion Jamaican dollars. The third phase and the final phase, which is a phase I will designate as the resilient phase, so restart, restore, and to make resilient, we'll see activities that will make the facilities resilient to natural disasters like hurricanes and meet the business continuity standards that is required when we have these occurrences for an essential service like health. The program of work should be implemented within 24 months or more. And as I said before, we already have the standards for this, the smart facilities. Only phase 1 will be undertaken in this financial year. It's important to note. So the 1.7 billion that we quoted to get activities back to normal, only that phase will be undertaken in this financial year. The work will continue as we go into additional years. All right, so that's the update on the infrastructure. I want to now turn quickly to mosquitoes. So I know that this has been said before, and Ms. Huntley-Jones will elaborate on this, but it probably should be noted that there are approximately 74 species of mosquitoes in Jamaica. They are part of us. And a nuisance part, sometimes a dangerous part, a health threat part, but it's something that, a creature that we won't be able to get rid of. It's endemic. And so it's a matter of how we manage. With the recent passage of Hurricane Beryl and the reality of the rainy season coming up, there will be a significant and sustained increase in the local mosquito population, both the vector and the nuisance population. The vector, of course, is the one that carries the virus, dengue. Could carry other viruses, but that's the one that we are accustomed to, dengue, and that's the Aedes aegypti. And then the nuisance population are those that will be a nuisance. They'll bite, they'll sing around your ears, they'll be in your space, but they don't carry the virus. And we thought it was important to make that distinction, although we accept that whether they have the virus or not, the fact that they're a nuisance is a problem to the population, to the people of Jamaica. Before the passage of hurricane, the Brito index, or BI index, which measures the number of positive containers per 100 houses was very low, at a figure of approximately 18.6, meaning that for every 100 houses that were, or premises that were inspected, just about 18.6, maybe round off to 19, had evidence of mosquito breeding. And it's not a bad statistic. Obviously, we don't want any breeding sites, but a lot was done with the dengue challenge that we faced with the team in the field to try and bring that population down through oiling, larvicidal work, and also fogging. In the wake of the hurricane, all containers treated, however, have washed out and refilled, thus significantly increasing the number of mosquito breeding sites. And the evidence of that is very, very, very clear. So we are not going to debate that at all. There are mosquitoes all around. Included among them are what are referred to as cryptic breeding sites. That is, sites that are not readily visible to the eye or which may be beyond our reach. We're talking about rocks with depressions, underground drains as well, vast swampy areas that oftentimes the vector management team may find it difficult to reach. And with the recent passage of rains, there are going to be a number of remote areas where mosquitoes are populating the surroundings. And even with our best efforts, you're going to find that until that population naturally declines, you're going to have this challenge, which is a problem, which we have to make the best effort to address. At this time, I want to just invite the Chief Medical Officer to give an overview on the mosquito that carries the virus, dengue. So we have an appreciation for what's happening in the population as it relates to dengue. And then I'm going to ask Ms. Huntley-Jones, who is at my extreme right, to give a further update in a more general way. Just to say that while we are always very sensitive to the dengue virus and trying to control that virus from reaching the population by addressing and targeting the Aedes aegypti mosquito, we're also very cognizant, very sensitive to the fact that the nuisance mosquitoes are out there and they are a problem to the population, particularly with communities that have low-lying areas, lots of water, and where they don't have electricity. And in other words, they can't close their doors or windows. It is a problem, and we accept that. And I'll speak to some of the measures that we are going to be employing or are employing to try and address that. But I want the CMO to just comment on dengue, because normally in these situations, you would have a spike in the breeding sites for the Aedes aegypti also. CMO.
All right, thank you, Minister. Morning, everyone. Yes, it is indeed timely that we should speak about what's happening with the situation of dengue in the country, because with the increase in the number of mosquitoes, then certainly it is going to put us at risk. If we look at the slides, as at July the 16th, 2024, the National Surveillance Unit recorded between 2023 and 2024 11,768 suspected, probable, and confirmed dengue cases. So in 2024, so far, we would have been notified of 1,406 cases, and in 2023, we were notified of 10,362 cases. Of these cases that were notified, 1,774 were confirmed. The predominant serotype was dengue type 2. 1,746 were confirmed to be dengue type 2. We had one co-infection with serotype 2 and 3, 3 serotype 3, and 4 serotype 4. And we have 20 that we are awaiting the results. For the period 2023 to 2024, we would have had 29 dengue-related deaths, 19 were suspected and 10 were confirmed. And this just shows that dengue is a very serious illness, and at this time we really have to be very cautious in terms of preventing those mosquito bites. So this is what the epidemiological curve looked like, and at the peak of the curve what you would see is what happened in September, October, and since then our numbers have gradually gone down. For this outbreak, compared to say 2019, where we had a protracted period of elevated numbers, I think that based on the interventions that were done in terms of the vector control program, and of course the sensitization of the public in terms of going to seek care early, we were able to bring down the numbers very quickly. And so it's very important that we sustain the activities that we have been doing in terms of keeping those numbers down, destroying our breeding sites. And so we would see that since this year, 2024, next slide. Since this year, January, which we see in red here, the numbers have been low, not getting us quite below the threshold as yet, but certainly there has been a decrease in the numbers. But the population should recognize, though, that July, August is when our numbers would typically increase again. And so therefore, it is really important that we take the precautions, because we don't want to go into a spike in terms of the number of cases of dengue. Next slide. Next slide. So if we look at the parishes that were mostly affected, this slide just gives you an overview as to what is happening across the parishes, and where you see the yellow and the orange, or the yellow and the red, that those would have been the most affected areas. And why I think this slide is important is because you will notice that the parishes in the south, this indicates, of course, where it is that we're going to have most breeding sites, because this is where we saw most dengue cases. So the parishes in the south were mostly affected, and of course, for Hurricane Beryl, the parishes that were most affected were the parishes, again, that would have had the most breeding based on the number of dengue cases that we would have seen last year. So it's really, really, again, very important to highlight the precautions that need to be taken, especially in these parishes. And these are, we're talking about on the western side and going into the south in terms of Westmoreland, St. Elizabeth, Manchester, and Clarendon. Next slide. So this gives this slide here gives a comparison between what has happened with dengue 2016 to 2024. 2019 was our big outbreak where we had a significant number of persons affected. And if you notice in that here, we had just under 10,000 suspected, probable, and confirmed cases. And we had 75 suspected, probable, or confirmed deaths. I think that between 2019 going into 2023, based on the efforts that were made in terms of public sensitization, people were more aware of seeking care early, avoiding medication that could possibly lead to worse outcomes, such as some fever-reducing medications. I think that we saw an improvement. And while in 2023, which was our next outbreak, we had over 10,000 cases, the number of deaths were significantly lower in terms that we had 28 cases that were suspected, probable, or confirmed. So far for 2024, we have just under 1,500 cases notified, and we have had 1 death. The age groups that are affected are mostly our younger population. And we saw in 2019, when it was babies that were severely affected, in 2023, the young population, but still going up to the 5 to 14 age group. So between 0 to 14 was where we had most of the cases. And this, of course, would be because the older population would have been exposed to the various serotypes during their lifetime and may have resistance, while the younger population are more newly exposed to some of these serotypes, and so they will get more infections. But of course, it is a vulnerable population in terms of our very young persons, and so therefore, again, every precaution needs to be taken to prevent severe dengue in these children because it can lead to bad outcomes. Important to note again, and I think that it's very important to note that many persons who presented to our facilities that were notified presented early. So they came in with with no warning signs. The majority of persons came in with no warning signs, and we had fewer persons, less than 1,000, less than 600 persons that presented with warning signs, and 22 with severe dengue. And I think this is because of increased education among the population, and so that is why it's important for us to keep speaking about it, reinforcing to persons to recognize that yes, with the mosquitoes will come the possibility of dengue. You need to be aware of the symptoms, aware of the warning signs, seek care. Where it is that your symptoms are not improving, you need to go to the hospital for an evaluation. And you really just need to take it very, very seriously in terms of avoiding the possibility of getting dengue. Next slide. This is an important slide as well that speaks about dengue deaths by age and sex. And why I say by age is because you recognize that the majority of our deaths happened in the older population. And if we go 2 slides ahead, what we will see that persons with comorbidities are still at risk of having severe dengue. And again, even as we speak about dengue, a particular infectious illness, we have to be reminded about the impact of non-communicable diseases and the fact that persons must ensure that they are taking their medication and seeking care in terms of control of their non-communicable diseases, because we saw the impact in COVID. And now if we look at this slide, we see that the majority of deaths occurred among persons who had comorbidities, and even so more among persons who had multiple illnesses. So I just want to remind you of the symptoms for persons who may develop fever, and usually we will have high fever, headaches, pain behind the eyes, muscle and joint pains, nausea, vomiting, swollen glands, or waxen cannon as people call it, rash. So you may not have all of those symptoms because the presentation is quite variable and can look like a lot of things. And in some episodes of dengue in the past, we would have seen that people even presented with respiratory symptoms that made you think that it was the flu or a cold that you were getting. So the symptoms can be quite varied, and it's very important that you seek care with your primary care provider in terms of getting some treatment when you develop these illnesses. Many of these cases, you may just need a visit to the doctor and they can be treated at home. With symptom relief, such as, again, we talk about fever-reducing medication, and we will talk a little bit more about that. Next slide. But there are symptoms that can get worse, or when you see these symptoms happening, it means that you must go to the emergency department to have an evaluation. And I know that the emergency departments are maybe overcrowded at this time, and it is more work, but still it is better to be safe than to be sorry. You may have some lengthy waiting times, but it is worth your time to go and wait to be seen so that a proper evaluation can be done. If you have abdominal pain or tenderness, persistent vomiting, if you see that you have swelling, which fluid accumulation in the body, so if you have swelling of the limbs, if you have any bleeding, if you feel very restless or very lethargic, as you don't want to do anything, you just want to lie down and rest all the time. If you feel any swelling in your belly, that may be indication of organ swelling. And of course, once you come to the facilities, we will do blood tests that will show if there's any changes in terms of the blood indices. Next slide. And just a note again in terms of fever-reducing medications, because in the past, in particular in the 2019 outbreak, we would have noted that we had many deaths that could have been avoided if persons had not chosen to use medication that could worsen their illness. Most cases of dengue fever can be treated at home with pain medication. We advise that you use acetaminophen or paracetamol to control the pain or fever. Non-steroidal anti-inflammatory drugs like ibuprofen and aspirin are to be avoided. They can increase the risk of bleeding. I suggest that persons have a conversation with your pharmacist. If you go into the pharmacy to buy the medication, have a conversation with the pharmacist if you are unsure. For people with severe dengue, I just want to mention again that hospitalization is often needed. And I'm going to now ask Mrs. Huntley-Jones to speak a little bit about the variety of vectors that can increase during the hurricane.
Thank you, CMO. I am Shireen Huntley-Jones, medical entomologist with responsibility for the National Vector Control Program. So it's my task this morning to speak to you a little bit about mosquitoes, but I've thrown in as well a little talk about flies and rodents. Following an event such as Hurricane Beryl, we are likely to have an increase in mosquito breeding, flies, and rodent for various reasons. Next slide, please. Why is that going to be so? Let's talk a little bit about mosquitoes. So for mosquitoes, it's very obvious. With the passage of a hurricane, we have a lot of water being deposited. And with the water deposition, we're having increase in the number of breeding sites. Water being in containers, waters in tree trunks, water on the ground, water in drains. So there's a lot of breeding sites for mosquitoes. But we have not said a lot about rodents and flies. What would have happened with rodents with the flooding that occurred? Rats live in bars, in harborage. Once there's flooding, those are flooded out. And where are they going to go? They're going to seek refuge in our homes. So usually after a flooding event, we're likely to see an increase in rodents in our homes, so an increase in human to rodent contact. And there oftentimes are going to be an increase in the fly population because of the accumulation of solid waste. And so under the Vector Control Program within the Ministry of Health, following such an event, we are monitoring for these three situations. But let's go back a little bit to the mosquitoes. Now, oftentimes when you hear the ministry speak about mosquitoes, we tell you about the Aedes aegypti mosquito, because that's the one that is of epidemiological importance, because it transmits all the arboviruses that are endemic: dengue, Zika virus, and the chikungunya. But yes, surprisingly, we do have more species of mosquitoes, and in fact, we have 74 species. Next slide for me. 74 species of mosquitoes, and they're occupying various spaces. They have various distribution, various ecological spaces that they occupy, but they're all over. So yes, folks, we have 74 species. Usually, after such an event, we are likely, however, to be impacted by 4 to 6 of those species, because they are more in our domestic spaces. So we know about the Aedes aegypti mosquito that breeds in containers in and around our homes. So we're going to see more of the Aedes aegypti mosquito. We're also going to see more of, I'm going to use a very big word now, Ochlorotatus tenarencus, but it's just our salt marsh mosquito. These mosquitoes breed in swampy areas. They tend to lay their eggs on soils, and those eggs will stay there for months in dry situation. But once the rain comes and they're flooded, all of those thousands and thousands of eggs come out all at once. And so we're after an event such as a hurricane, we are significantly impacted by this mosquito. And its cousin, Ochlorotatus sollicitans, is another mosquito that most persons are complaining about now. And then we have the Culex mosquito. That's the one that breeds in drains, in sewage treatment plants. This one loves high organic water. So anywhere you see anything, any breeding sites with debris rotting and so forth, we're going to have a problem with mosquitoes. So what are we saying, folks? After the passage of Hurricane Beryl, we would have seen an increase in all of these mosquito population. And we understand, read the complaints, and this is what is happening. But it's very important to note that currently only one of these species of mosquito is acting as a vector, and that would be the Aedes aegypti mosquito. All the others are our nuisance mosquitoes, meaning they do not transmit disease. There are some images on the screen. Of course, in your home, mosquito is mosquito, but you won't be able to distinguish them. They all look alike, but not to the trained eye. And our teams have been out monitoring. We have been collecting. We have been monitoring bite per second. So just to monitor how much the biting frequency has increased. And as we do our implementation, we're monitoring how the biting frequency is decreasing. And so those are some of our mosquitoes that are troubling you now in your homes and in your community. I wanted for us to look at some of these breeding sites. So as I said, we oftentimes speak about the Aedes aegypti and its breeding in containers. But we have a variety of breeding sites now that would have occurred following the passage of the hurricane. And that looks like some of our backyards. Anywhere water is now settling and stands for over 7 days, we're going to have breeding in those water bodies. And this will result in the increase in the mosquito population. And we're seeing this in a lot of our communities that would have been affected following the passage of Hurricane Beryl. I put this slide in because most of us, especially in Kingston and in some of our urban, in our more residential communities, a lot of us have plants in and around the homes, like bromeliad plants, that are acting as containers for mosquito breeding at this time. And so when we visit sometimes and we say to persons, you know, you have mosquitoes, and they will say to us, but we do not have containers, there's nothing. But then we're finding these plants in and around the homes. Because of how the leaves overlapped, it creates a containerized environment. And if you look closely, you can see mosquito, the Aedes aegypti particularly loves this kind of environment. So two things you're going to find there, tadpoles and mosquito larvae. But this is going to be a major breeding site now that we would have had the rains. This is another cryptic site that we wanted to bring to the attention of the population. And this is something that we can't even treat. This is a honeycomb rock. The Aedes aegypti loves this type of environment. And there are many communities across the island that we note note where these occur and where breeding takes place. So we're talking about a community like in Hellshire or in sections of St. Anne. We have mapped these areas and we know honeycomb rocks. They are now breeding and breeding prolifically. So we continue to remind you that the Aedes aegypti is our main vector at this time, and it's our main concern. It's our container breeder, and that's the one that is going to be transmitting dengue, Zika, or chikungunya, and really that we have to, above all, pay attention to. Next slide, please, Stephen. Thank you.
Are you going back?
Back over.
No.
Okay. Right, so a solution that we have been promoting for many, many years is the use of this drum cover. Looks like a hairnet, but it's actually a drum cover. It's very, very effective in reducing the breeding of the Aedes aegypti. Why was this promoted as a solution? For our population in Jamaica, our main breeding sites are those 45-gallon drums. In every Jamaican yard, there is a 45-gallon drum. Even in communities that do not have a problem with pipe water, we find that it's a Jamaican tradition. It's like mothers passed down a 45-gallon drum to their daughter. And so this became a solution. And we're encouraging persons to make them, distribute them, make them at church, make them in your community. And it's simple. What is it? It's just a mosquito net that we use on our window. Very effective. It is a 36-inch in diameter, and it puts an elastic around it, and you make something like this. And you put it over your drum. It's very good because in communities that they do not have piped water and they have to rely on rainwater, it does not prevent those drums from getting water, which is very good, but it keeps the mosquitoes out. So we are encouraging persons, please, ladies department in churches, community groups, please make some of these drum covers and distribute them in your communities. Thank you, CMO. I turn back over to you.
What about the rats and you spoke enough about the rats and the flies?
For rodents, thank you, Minister. Let's talk a little bit about the rodents. It's going to... Because of the floodings that we've had, persons are likely, especially in those parishes that were really affected by the hurricane, to see an increase in rodent populations in and around our homes. Two things we're asking persons to do. One, manage your solid waste around your house. Rats like water, food, and they're looking for somewhere to live. So your home is the place that they have come now to live, but you can't entertain them. If you are providing water and access to food, then you're entertaining them. And so in order to chase them away, you've got to make the environment uncomfortable. And that is simply by just removing access to food. So we're asking you to please bag your solid waste, containerize them in such a way that the rats won't have access to it. And also, do not allow them to have access to water. If they're going to stay, they'll probably put you out as well. And what about flies? Flies are going to be around because of the solid waste issue. Again, it's a matter of how we're managing our solid waste. Once you have solid waste around your home, if you're having length of times in terms of the frequency that your garbage is being collected, it is important that we bag those our solid waste and keep them containerized so that the flies will not have access to them. Very important at this time. So the rodent control and the fly control is a matter of solid waste management. Thank you, CMO. Thank you, Minister.
Thank you. Pass me that thing for me. So I think the knowledge is important, and so we try to allow the experts, in this case the CMO and Ms. Huntley-Jones, to provide information so that we all can appreciate a bit more why we have the increased population of mosquitoes and the differences between one mosquito species over another. Just to reiterate, the Aedes aegypti mosquito is the mosquito or the vector, the carrier of the dengue virus, chickpea, zickpea, and so on. That's the one that we typically target to eliminate. That's the one that the team go out and inspect breeding sites and identify, and they have the wherewithal to identify them and treat with to minimize that population. However, let me be very clear that for the typical Jamaican in their home, right at this point, a mosquito is a mosquito. And if they bite, if they sing around your ears, if they are all over you, as I have seen in some communities, we have seen that. I've gotten the videos, I've gotten the pictures, and the team who have been in the field, I've not been as active in the field, but I intend to in the coming weeks. They report back that the population has increased significantly. So we fully appreciate that the increase in population, whether it is Aedes aegypti or otherwise, is a major nuisance to persons living in particular communities, but generally speaking across the country. So we have developed a program to ease the burden, and I should have asked Ms. Huntley-Jones to comment on what the projections are in the coming weeks, whether a month, 2 months, because I believe there's a period in the immediate aftermath of a storm of this kind that we have just experienced, where after a few days the population increases significantly, and then with time it declines, whether through our efforts to eliminate some of the population or the natural cycle. I think it's an important point to raise. I'd ask for it to be included here, but because in a sense, the nuisance mosquito is a part of the misery index that many Jamaicans are going through now as part of the impact of the hurricane. So just as though you'd lose a roof, which is undesirable, which is very negative, which we don't want, the mosquito breeding is almost predictable in the very immediate aftermath. and you literally can plan for it, unfortunately. It's part of our ecosystem. But then there's a period at which it peaks and then declines. And it's not an excuse to say you must bear it. It's almost trying to inform sufficiently for persons to understand that it's almost a cycle that we're going through, and we have to make our best efforts. We all have to play a role in that regard. And Ms. Huntley Jones, I don't know, could you just quickly, in a minute or so, comment on that cyclical scenario?
Okay, certainly, sir. So for the nuisance mosquitoes, we would have seen just little after a week a significant increase in those populations. And that increase will continue for about 4 to 6 weeks, depending on where their breeding sites were and the temperatures where they are. So for the 6 weeks after the event, it's going to be quite uncomfortable because of just the significant increase in those mosquito population. For the Aedes aegypti, however, the population will take about 3 weeks after the event to go up, and that will continue over longer periods of time, depending on how we manage those containers. And so for the nuisance, for the next 3 weeks, because we're now 2 weeks post, so for the next 4 weeks, we're going to really be under the pressures of those mosquitoes. But those populations will naturally go down. And with our intervention, we're trying to force it down sooner than the natural cycle will allow. But so another 4 weeks, possibly. And please recall as well that we continue to have rains. So that's the difficulty, the challenge we're in now, because if we were not having rains, some of those breeding sites would have naturally dried out. But we continue to have rains, and so that has contributed to the situation. Thank you, Minister.
I thought that was an important additional piece of information. Again, it's not an excuse, but I think the public needs to be informed that because some of these breeding sites are not as accessible, and for all the other reasons given, we can expect a fairly intense population until the cycle tapers off. But what that means, though, is that the Aedes aegypti mosquito will continue to be a threat, and so we have to continue the efforts against that. All right, so the ministry, having looked at all the considerations, we took a conversation to the Cabinet of Jamaica and advanced a proposal to do the following, which has started, but I'll just bring clarity to that strategy now. So we intend to engage an additional 400 vector control workers to bring the current number of temporary workers to 1,000. They will be assigned to high-risk communities to identify and treat breeding sites. In addition, they will assist with the fogging activity, so the larvicidal activity that takes place. So you will recall that in the past, and even now, we have these workers, 600 of them approximately currently, we're going to up that to 1,000, that go out in communities, visit homes, inspect water catchment areas, identify the mosquito breeding sites, and then treat with them. They put a little tablet in the water. In some instances, if it's oiling that's needed, the persons are advised who are the experts on that, and of course they can advise as to when fogging is going to take place. So we're expanding that population of workers so that we can provide a greater coverage across the country to support the efforts at elimination of mosquitoes or mosquito breeding sites. In terms of fogging activities, we have extended fogging activities to 7 days a week, and these are being conducted both in the morning and evenings. Okay, we're extending fogging activities to 7 days a week, and this is both morning and evenings, with special emphasis on urban centers and high-risk communities. As such, we are covering some 18 to 20 communities per fogging session and 30 for larvicidal work. The other response is to expand the fleet or the team of foggers outside of the government contingent. We are engaging private pest control operators to the extent that they are available to further intensify the fogging activities in areas most needed. Up to this point, we are targeting approximately 10 private contractors. If there are others out there, because you have to have a certain level of certification to be a private contractor, we're willing also to engage based on the extent to which the challenge is there. And the intention is to engage these private contractors over the next 2 months or so until we can get the population to a level that the ministry's team can manage. So that's one other strategy, private contractors. And then the ministry will also be distributing drum covers, as said earlier. We showed this earlier, but there are some others too, but this one I think is the one that's easiest to be made, right? The Suntley drum, right? To help to stem the significant areas of population for the Egypti, the vector for dengue. Already, since March last year, we have distributed about 11,000 of these covers, provided by the Pan American Health Organization. Since burial, we have distributed a small number, about 500. Of course, this is we need to increase this. So we're now looking to procure some 20,000 for distribution, 10,000 of those coming from UNICEF. So we are collaborating with our partners to ensure that we get as much support as possible in terms of covering these drums. And as Ms. Huntley-Jones said earlier, citizens can play their part too in terms of trying to eliminate some of these breeding sites. Given the current levels of mosquito infestation, and the ministry is recommending the partnership that is necessary between ourselves and citizens in their communities to, in the first instance, protect themselves against mosquito breeding sites. So the search and destroy breeding sites around the homes is very important. As citizens, we should take the opportunity, whether once every few days, at least once per week, to just walk around your home and just look for these breeding sites. Some of it may be in your house, on the vase, in the vase, on the whatnot, or the dining room table with water. The used tires, the old milk tins at the back, so the solid waste. And it's important that you take that on as a personal responsibility to protect yourself. So we continue to encourage that, and that will be part of our public education program. Use repellent containing DEET for outdoors activity in particular. You do have these commercial items that are sold, repellent, in the stores. So it would be advisable for each person to source and purchase any repellent that contains DEET and apply that in your movement so that you protect yourself. Use commercial aerosol, that is a mosquito or insects, and the commercially available product can be effective in killing them. So you have a number of these commercial home use pest control sprays, for want of a better word, without naming a brand, that you can use. There is a suggestion that when you leave your homes, you can spray the house, lock it up, leave. When you get back, it would likely kill the mosquitoes that are inside, and of course you can reduce your risk in that way. So it's very important for us to understand that we all have a responsibility, despite the responsibility and the obligations that the government has and the Ministry of Health. As far as possible, avoid being outdoors during the peak activity time for mosquitoes. Maybe Ms. Huntley-Jones can comment on that, since she's the expert as to where they live and how they exist and when they are out more than others. I have a feeling, but I'm not the expert, between dusk and about 7, 8 o'clock, they come out in their numbers, right? Yes. I think I'm correct there, right? For some reason, I don't know if they're sleeping the rest of the day. They are, okay, all right. That was a guess, and she says yes. But during that period of the sunset to a few hours is when you have a lot of mosquitoes out. So you have to prepare yourself for that. It must be noted, too, that a bite from mosquitoes can result in an allergic reaction in those persons who are allergic to insect bites and can lead to secondary infections. As such, persons must make every effort to reduce the number of bites they are exposed to. by taking some of these personal protective measures. So the mosquitoes is an interesting creature, and it presents an interesting phenomenon for us in the tropics and in our island. Many of you probably wouldn't know that there are so many species because we have focused a lot on dengue. But right now we know that the nuisance mosquitoes are as big a problem, maybe even bigger than the Aedes aegypti. And so we really have to prepare and deal with this massive increase in population while we try to bring that down to a more manageable level, which was the case prior to Hurricane Beryl. So we're going to do the best we can to give support. I want to assure the public in conclusion that the ministry is aware of the challenges that they are facing in the cases based on Beryl's passage and the impact on health centers. I should say too that of the number of health centers impacted, the worst affected ones, we have made efforts to relocate where we can't operate within that same facility. So health centers like Southfield in St. Elizabeth, Newell in Southwest, those where the roof was so damaged, we have found alternative locations. So what we will do is communicate with persons in those communities on the ground so that they know where the service is while we deal with the immediate repairs that are necessary to get back into those main buildings. We will continue to monitor the environment and adjust our strategy as necessary and continue to inform the public as it relates to what needs to be done. In the meantime, the public health system is there for you. If you have a cause, an emergency, and you need to visit a hospital, no money is going to be left behind or ignored. Our standard operating procedure is that we are an essential service, a life-saving service, and the system is there to treat with those who need it. So please don't be shy about visiting your parish hospital, if necessary, or health center in your community for support. Okay, I'll stop here for any questions that you may have. Thank you.
All right, Kalisha, sure. Yeah, man, you can go ahead. Oh, there's a mic here. Just introduce yourself.
Good morning, everyone. Kalisha Williams, Television Jamaica. I have a few questions. I know we got the figures from 2023 up to July 16 in regards to the dengue cases, but I know it's also early days, since the hurricane passed. But in terms of the data or any trends you've been noticing specifically since the hurricanes, I know you said it's been increasing, but in terms of how the species, have been reacting since the hurricane. And in regards to other illnesses, probably for the CMO this one, are you seeing an increase in other viral illnesses? I know especially our newsroom, we have been getting a lot of complaints in regards to flu-like symptoms, sore throat for the past few weeks now. Thank you.
Let me ensure that I understand your questions. You're asking if we've seen increases in the Aedes aegypti or in the dengue cases? Dengue. All right. So we are continuing to monitor our Aedes aegypti population as a matter of priority. We have not yet seen an increase, but we have noted that there are a lot of containers, a lot of breeding sites in and around the homes that the teams have been visiting. A part of our strategy, however, following such an event, that we are not waiting for breeding, we are treating before we begin to see breeding, to prevent an increase. However, I must take the opportunity at this point to say that we are not seeing where our citizens, householders are assisting us by dealing with those breeding sites. So post-burial, with the teams going out, we're still seeing tarpaulins, drums, cans just around persons' home that have just sat there since burial and persons have not gone out. So again, I'm taking the opportunity to ask persons to please partner with the Ministry of Health. When we come to your home to treat a container, we just want to treat those containers that you can't get rid of because you're storing water for usage. But certainly those other containers, we're asking you to get rid of them. Thank you.
All right. You want? Yeah, man, we're responding to the second.
We can report on what is reported to us. We have various surveillance systems in place. Our facilities report on cases of fever and rash, fever and respiratory symptoms, fever and hemorrhagic symptoms, fever and neurological symptoms, acute respiratory illness, severe respiratory illnesses. So those are some of the routine surveillance that we do. We have not really seen an increase at this time. What we can say that in terms of for COVID, we would have been seeing an increase in the positivity rate, not the number of cases that come in for testing, meaning that persons with respiratory symptoms would be tested, but we would have seen recently an increase in the positivity rate, not overall numbers of persons coming in, but the positivity rate for COVID. Yes.
All right. Just introduce yourself, please.
I'm Jerome Williams from the Jamaica Observer. As it relates to the restoration efforts for hospitals, you mentioned the 3 hospitals, Black River, the Falmouth, and the other one I don't remember right now. What is the progress made so far in terms of the restoration efforts? What are the specific issues affecting these hospitals? And is it possible to give a possible timeline into when these hospitals will be somewhat fully functional?
Yes.
So thank you very much. Should I introduce myself?
Please. Famous.
Dunstan Bryan, Permanent Secretary, Ministry of Health and Wellness. So the hospital requires the support systems, electricity and water. And in the case of the Black River Hospital, and also in the case of the Falmouth Hospital, we are still having issues with, well, not Falmouth, but Black River. There are issues with water in terms of, electricity, sorry, not water, electricity that does not allow us to have full operation. So when we talk about emergency mode, it's just that we are not able to provide elective surgeries, for example. And so we have to do just the emergency operations, A&E support, etc. So that's primarily the issue that you're having with it. For Falmouth Hospital will be up and running within the next 2 weeks, as the minister says. It was that there was a damage to the operating theatre roof. And because the roof of the operating theatre has been compromised, you cannot do operations. So we have to go into emergency response. We have to do only emergency response. So we have to curtail the number of surgeries that are done. So you can't do elective surgeries, for example, to undertake the complete operation of the hospital. You're good?